Where did the coronavirus come from? Social media is rife with claims it was weaponized in a secret laboratory designed to put a stop to exponential global population growth. Others say the new 5G mobile phone technology helps the virus spread. These pictures call for the destruction of 5G transmitter masts.
Pandemics offer the perfect environment to encourage the spread of conspiracy theories.
Powerful forces are said to be behind the pandemic. There is talk of enforced vaccinations and blanket state surveillance. The monstrous microbe as a global conspiracy. An evil plot to rule the world. A billionaire who wants to get even richer with the cure to a virus he created. I'm sorry to let you down, folks. That's Hollywood. This crisis is spectacular enough without having to be spiced up with conspiracy theories.
Is this the new normal? Widespread protests against lockdown measures in Germany, Britain, and the US. And conspiracy theorists are among the most vocal. They believe secret organizations are behind the coronavirus outbreak.
The government has taken advantage of a virus.
It's just a means to an end, and they're pursuing a different agenda.
We can't keep on printing money out because then we're going to end up like 1930s Germany.
How can we deal with such confusing statements? Pia Lamberty has written a book analyzing the psyche of conspiracy theory supporters. She says it's an instinct to be more secure and be in control. In a situation where we have so little control, the conspiracy theorist provides a perceived structure, stability, and makes sense of everything. The virus is invisible. It's an invisible threat. You can understand the conspiracy theorist. You can't demonstrate against the virus. That wouldn't help. But if you think somebody's behind it, you can take action. There have long been conspiracy theories. The assassination of John F. Kennedy by intelligence agencies is among them. One suggests the death of Princess Diana was a long time in the planning. They say the contrails of jets are in reality trails of toxic chemicals. And the September 11th attacks were carried out by the US government. Supporters of the QAnon conspiracy theories that have proliferated on online message boards believe that many celebrities are involved in a pedophile ring. I always speak out against calling them crazy or stupid people. That's not true. But I think you have to be careful not to get into too much discussion about it. We have to understand their fears. They are all just concerned citizens. At the same time, such bad images are being spread. Bill Gates is currently a key target of hatred. The conspiracy theorists allege the Microsoft founder helped develop the coronavirus, and he even wants to implant chips in people to check their health. German conspiracy theorist Ken Jebsen has railed against Gates on YouTube with more than 3 million views. Whether you have to wear a mask or whether this country is in lockdown or not, that's now determined by Bill and Melinda Gates. How should we deal with people who refuse to listen, if they fend off any criticism when everything becomes so diffuse? I think that during the past few weeks, our awareness has increased and we can say, oh, we've got a problem. Will the ranks of the conspiracy theorists grow larger and louder in the coming weeks? One thing is clear, there will always be conspiracy theories, especially in times of crisis.
Michael Butte is from the University of Tübingen. He investigates conspiracy theories and joins us now. Just how much truth is there, or is there any truth to any of these conspiracy theories?
Well, there is very little truth to virtually all of these conspiracy theories. Of course, there is the Bill and Melinda Gates Foundation. Of course, the virus originated in Wuhan. Of course, there are people who are working on a vaccine against that virus, but I think that's basically it. So conspiracy theories make what Richard Hofstadter called a curious leap in the imagination fairly early on, and then basically leave the facts behind or construct their own facts.
We've all had quite a lot of time in isolation to think about these things, haven't we? But tell me just how new these corona conspiracy theories are?
Actually, they are not that new in that most of the corona conspiracy theories, no matter which version and where they're virulent at the moment all over the world, they're usually only the latest chapter in much larger and longer conspiracy narratives. So the villains, to a certain degree, were already clear, and now corona is just the latest chapter, the newest episode in that story. So not that new after all.
Who's behind them, though?
Behind the conspiracy theories?
Yeah.
Well, it's people who genuinely believe that they have found out what is really going on. That's one of the major differences between conspiracy theories and fake news. With fake news, we usually assume that the people who put these stories into circulation are doing so cynically. They know that they are lying. With conspiracy theories, this is possible too. Some people are cynical about them and they just circulate them for political advantages or economic gain. But most people who are behind the corona conspiracy theories, and these are people all over the world, from the left, from the right, people who think of themselves as moderates, they are genuinely convinced that they are doing a service to mankind by exposing what is allegedly really going on.
Michael, isn't there a lot more to this than just conspiracy theories? I mean, doesn't this boil down to a crisis of trust?
I think it's a symptom of a crisis of trust. And I think that we see a larger crisis of trust and a fragmentation that is running through Western societies, particularly pointedly with regard to conspiracy theories, because here we have two publics that actually are looking suspiciously at each other. There's one public that is worried about conspiracy theories, and there is one public that is worried about conspiracies. And these publics look at each other, they watch each other and realize that the other is out of touch with what they realize is reality. So from the perspective of the reality that you and I are in, of course, there is a problem with trust. There's a problem with trust in traditional expertise, in science, in politicians, that makes solving the problems that we have to solve as countries and as the whole world really difficult.
We brushed over some of the theories. Are there national differences?
Yes, there are definitely national differences. So, for example, in Germany, most people believe that the virus either is completely harmless or does not exist at all, because things went actually quite well here. The lockdown worked, there weren't that many people who died. And therefore, the alleged plot is to take our civil rights away and to introduce a global vaccination program. In France, for example, where there were many more people who died, most people believe that the virus was actually constructed in a laboratory, that it's a biological weapon. In the US, people link it to the QAnon and the deep state conspiracy theory. So many people on the right think that it's a plot to actually hurt President Donald Trump and to prevent him being reelected.
Michael Butter, very interesting stuff. Thank you very much for joining us. Michael Butter from the University of Tübingen. He investigates conspiracy theories. Thank you.
Thank you so much for having me.
And time for your questions on the coronavirus. Here's our science correspondent, Derek Williams.
How was Taiwan able to contain the spread of COVID-19 so successfully?
Taiwan was badly affected by the SARS outbreak back in 2003. It killed over 180 people there. Its mortality rate was higher than anywhere else in the world. After that, the island's government put detailed plans in place to deal with possible future outbreaks. And they kicked in very quickly after the very first reports of a new pneumonia in Wuhan, days or even weeks before most of us had even heard of this disease. The actions that were taken appear to have contained COVID-19 very well. They included border controls, a 14-day quarantine on international arrivals, closing venues where large numbers of people could gather, and a ban on the export of protective masks. So far, there have been fewer than 500 cases of COVID-19 on the island, and just a handful of deaths.
How effective is social distance in preventing the spread of COVID-19?
A research team in Germany looked into this and found strong correlations between the introduction of specific interventions and the spread of COVID-19 in the country. Using established models, they came to some key conclusions, not least that social distancing measures began to really have an impact 2 weeks after they were implemented, which dovetails with predictions involving the SARS-CoV-2 incubation period. The team also tried to break down exactly which measures had which effects and concluded that growth rates were slowed most dramatically by prohibiting large public gatherings, later decisions to close schools, and then non-essential stores during what was called the country's lockdown light also had measurable effects. The team concluded that it took all three measures to flatten Germany's curve so quickly.
Is the body of someone who's died from COVID-19 infectious? And if so, for how long?
Scientists are still working on answering this question, but the safest assumption is yes, bodies can pose a risk, but a low one. That's because the virus remains viable on other surfaces for varying amounts of time. So there's no reason to think it wouldn't remain viable on a body as well. Research carried out in this direction during the SARS epidemic also implied that bodily fluids from someone who had died from that disease could remain infectious for up to 96 hours. That said, the evidence indicates that COVID-19 is spread mostly through respiration and droplets, and less so through direct physical contact with surfaces. So the body of someone who has died from the disease is generally being viewed as less of a risk for transmission than a living patient.